welcome. So, welcome back to the Holistic Actions
Oh, it's
community.
chat. I need to open the chat.
Q&A, yep, Q&A for what's this month? We're ending
July.
July GI month, and we're about to go into our mobility month, but all questions fair game today. So, we are going to address all your questions by reframing them a little bit based on context that some of you may not have yet, but we're gonna talk about that in the next hour. And feel free to write your questions in chat. Raise your hand by clicking raise your hand.
Clicking react, and then under that is raise your hand.
I'm
Or,
always right, or just do that.
but you
Well,
have to have your video on for us to see your hands that way.
no, they don't. But
I can't see them do this if
oh,
they,
that one, yeah,
that
yeah.
one, that's what I
I
said.
can't see any of the videos, but that's true. Yeah, good point.
So, a couple of things. We don't have as many this time, so we don't have to rush the way we usually do. We'll have a little bit of more breathing time. Often we have 30 to 60 people on here. So we'll start with Kai. Welcome.
Hi.
Hi.
Hello.
Hello, hello.
What's up?
Um, what should I do? Ask the question?
Absolutely. Do you have a question? You raised your
Yes,
hand.
yes, I do, I do. Um, I have a 6-year-old chow chow, a male, and he he has actually there's been like several different diagnoses. But they have told me that he has severe colitis. He has mucus in his poop like every single day. And
So
he has lost completely his energies. And I think he has massive digestive issues. Some doctors have said he has dysbiosis. So, and the microbiome on like unbalanced and so on. And
sure.
gastritis is also one of the diagnoses. But what has happened is after every 3 months he's getting inflammation and fever, and the blood test showed a really high polyarthritis. Rheumatoid factor was like quite high.
Well,
So
so Kai, where do you
mhm.
live?
In Estonia,
Okay.
in
So,
Europe.
yep, yep. So and have you been on our calls before?
No, actually, I haven't, but I'm a member of
Holistic
your.
Actions?
Yes, yes.
Wonderful. Have you been to the forum? Have you posted this in the forum?
I have posted this arthritis thing when he had wintertime when his arthritis were really bad, and I've had a quick call with Jeff as well, like in last autumn. But
Okay.
then he had this Advantix poisoning last year, and this year he had coma from meloxicam and amoxicillin.
Right.
So.
So the thing is, one of the things we talk about, at Holistic Actions, and this is for everybody, whether you're a member or not, is creating your holistic pet care team because we're here to help guide you and advise different directions that you could go in. Um, but we can't, even on the forum, we're not able to be treating. Your dog clearly has an imbalanced energy field, right? Regardless
Mhm.
of whatever, it's this problem and then that problem and then this problem. So you definitely need to be connected with, you need to have a holistic, preferably a homeopathic veterinarian who
Yeah,
is
help me
being in
find that
charge,
one. We
right?
don't have we
Well,
don't have in the Baltics this. Yes,
yes, but that's
I've
what I,
searched
wait.
everywhere.
Hang on a sec. So here's the wonderful thing about homeopathy is that homeopathic veterinarians can work virtually. And there are other veterinarians who do other modalities who can also work virtually. And so when you go to, maybe Jeff, you could post the international and CIVT, if you'd put both of those in the chat. If you go to the article on working with a holistic veterinarian, this is for everybody. We have, the article really helps you know why you have to go to all these different websites in order to find a vet. But for homeopathy is where you're most likely to find the virtual vet. So for Europe, you can go to any of the homeopathic ones. There's the Academy of Veterinary Homeopathy, the International Veterinary Homeopathy, International Association of Veterinary Homeopaths, and the CIVT. So those are three that wherever you live in the world, those websites will help you find veterinarians. Now, in addition to that, I will post this in the chat. So this is a veterinarian who is a Dutch veterinarian, and she moved her family to Portugal because she felt it was better to raise her daughters there. So for those of you who are international, she speaks Spanish as well as, maybe it's Portuguese, I'm sorry, but as well as Dutch, but she does speak English very well. And she is, and she's an intuitive veterinarian, and she's been trained in many different modalities. She so she is somebody, she works virtually. So she's somebody who could make a big difference for you. I have not, in speaking with her, I feel very comfortable in referring people to her, but I haven't as yet had feedback from anybody who's worked with her. So she's definitely one option for you. And then, like I say, go to the IAVH that Dr. Jeff put in there. It doesn't say, unfortunately, who does virtual. And the other is the AVH, the Academy of Veterinary Homeopathy, also lists, but they specifically list the virtual vets. So at this point, because I mean, you must set with that. You must get set with that. Schedule your 15-minute appointment with Dr. Jeff and I, and we'll help you find a vet if you haven't found one yet. Post in the forum and post in the forum and post in the forum. Okay? Really do more of posting in the forum to follow through.
Okay.
Does that help, Kai?
Yes, I will contact. I've been actually treating him now with homeopathy already as well. Like I've been getting help from here and there from human homeopaths, but I really need a holistic vet. Yes, that is true.
Okay, well, I would go to the
I mean,
IAVH that he put in and also look at the Don Hamilton is the president of the IAVH, and he does virtual, and he's so he'd be listed there, and I know he does virtual.
okay, that's awesome.
Great.
Because
Keep us
the
posted.
regular
Oh yeah, no,
veterinarians.
Kai, we don't have time to talk about that. We know what the conventional are telling you. So now you've got your
Yes.
next steps, okay? And
No, they
intuitive.
just said that we can't help you.
I know. You now have your
Yeah.
next steps. We have many more people to talk to today, Kai. Excuse me. Are you
Yes,
set for your next steps? And thank goodness you're a member. You can follow up with us
Here you
there.
are on my screen, please.
Okay. I need to ask Jackie. I don't know who you meant. Intuitive vet Dr. Chambera. I'm Dr. Chambreau, but I'm not an intuitive vet. So you'll have to enter that again in the chat, please.
Well, I was addressing you.
okay.
I'm sorry. I know that you're Dr.
Oh,
Shambro.
okay.
No, somebody actually answered the question. Ruth did. Thank you, Ruth. She said Dr. Sagrera. I just didn't know how to spell the
Okay,
name.
Dr. Segura is a homeopathic veterinarian who will work virtually. She's not an
Okay.
intuitive.
Oh, she's not.
No,
Okay.
she's not an animal intuitive. She's a
Oh,
a classical homeopathic veterinarian trained the
okay.
way Dr. Jeff and I were.
Okay.
Um,
Because
and
I thought you had said that we should get checkups with
yeah,
intuitive medical vets twice a year.
oh, not necessarily a vet.
Or well, with an
Those are
intuitive.
harder to come by.
Yeah.
But good point. My suggestion is working with an intuitive twice a year, just to get in relationship with them and have them do a body scan. And those are not veterinarians. They do work virtually. Number one. And number two would be to find a veterinarian using and you don't have to be a member for this,
Yeah, I've used it.
holisticactions.com/select,
Yeah.
and find a veterinarian who does acupuncture, homeopathy, or acupuncture, chiropractic, or osteopathic, so they can do a physical exam, even if you have to drive several hours once a year to do that. Those were my two suggestions. There are a few veterinarians who are intuitive or shamanic healers, and they're sort of scattered through our holistic actions, webinars that we've had. If you want some specific help in finding one, you could schedule a coaching appointment with me. But it does
Okay.
take some looking and trying, Jackie. You have to experiment. How do I feel with this one? Does this one feel right for
Yeah.
me or not?
No, okay. I'm sorry. I thought you had just given a specific name and
No, the only one I just gave, I did post, didn't I put it in the chat?
yes, you did put one in the chat.
Yeah. Who was I hope I did. Did I, Jeff? Put in that Suzanne Betnick? Let's see. I'm gonna pop it in again in case for some reason didn't get in. Okie dokie. All right.
Thank you.
Mayoko, you're welcome. I want to really thank you. Is it Miyoko or Mayoko?
It's Miyokyo.
Miyokio. Got
Yeah.
it. Miyokio. Sorry, I missed the second Y. Um, I want to really thank you for how much you post in the forum. It's
Oh,
really wonderful because we can continue the ongoing conversations, and hopefully that's been useful for you.
yeah, I really appreciate it. Yeah, yeah.
Excellent. Just for other people, you know, you can, she says it's good, so
It's
try
great.
it. What can we do for you today?
My neighbor's dog, my neighbor dog, listens,
Okay.
Grant, has a growth on her front elbow, left front elbow. It's been there for about a year. It's been growing, and apparently no pain. It moves a bit. Her mobility is not affected. It doesn't seem. They say it doesn't affect her mobility. They're going to get a biopsy in a week. And she's 10 years old. She's a mixed husky dog. And I wonder what they might find other than a lipoma.
It could be anything.
Yeah,
It's pretty hard to say what a
yeah,
lump is. What you want to be talking to her about, though, is that regardless of what the lump is, energy medicine can really make a huge difference, even with lumps. And you know about the Bingston method.
okay, yeah, thank you.
So you could refer her to that book, The Energy Cure.
Okay,
And she could start doing that now if she wants to even wait on not doing the biopsy.
yeah,
It's like if it's not causing problems or interfering, and see if she can get onto a fresh food diet. So introduce her to all those things that we know.
yeah.
Dr.
Okay.
Jeff, do you want to do a list of what the lump could be? You're muted, Jeff.
Yeah.
I would vote for a high chroma.
Hi, Chroma.
Oh, yeah. Just the fluid filled. Would they keep growing though
They get
over
huge.
years?
Yeah, they can look,
Okay.
you know,
I
it's
thought they were
usually a
faster.
combination, usually inflammatory, uh, bursitis, the arthritis, I guess real question, my friend Miyako would be, what the dog's beam is. How's the dog's quality of life?
Yeah. Well, apparently, I see her every day. She comes by to see Listen. She seems fine. My concern is that they might choose surgery at her age and anesthesia. Like, I think that's just a really poor idea at her age. But
You know, everybody really worries about anesthesia in older dogs and cats. And if we can avoid it, it'd certainly be great. But
It
it's
is a
it's
different
pre-
world.
it's pretty safe these years. It's
Yes.
okay,
much better than it used to be. So
okay,
I don't worry. Like people say, oh, I don't want to do a dental because of the anesthesia. And can there be problems? Yep, there can be.
yeah,
But, and that's why we try to prevent problems ahead of time. That's what we focus on is looking at the whole being, the whole family, and the whole animal to prevent problems like that. But
okay,
I wouldn't worry about the anesthesia, not to
okay.
worry. And
Uh,
if anything, I would just talk to them about whether they really need to, feel the need to do the biopsy at this point,
right.
and maybe see if they want to work with a holistic vet.
Yeah. Okay, I'll pass that all on. Thank you very much. Yeah.
And I just want to ask one question, how fast it's growing, as far as you can see, it's getting bigger by the day, or
No,
No.
no, I think over the past year, I think it's been around
yeah.
for almost a year, and it's now about fist size. But still, it's not impeding her mobility. It's right at the elbow.
Okay, thank you. Miyoko. Ooh, I can't say it. Miyokyo. There we
It's
go.
like Tokyo, but Mio.
Miyokyo.
Yeah, yeah, that's perfect. Yeah, thank you.
Okay, whoops, Sophie just walked off.
Oh, she's back. She's
Hi, Sophie, go ahead.
Hi. Actually, your comment regarding anesthesia kind of led into my question. First of all, my sister dog, who's 13, just went through a really, really great anesthesia, and it went very well. So I can see that some dogs don't have an issue at all. But my dog, Mickey, who's only 7.5, every time he goes to a dental, it takes him such a long time to recover. And he also has prostate issues, but I don't want to castrate him because I'm afraid he won't um, recover from it for a very long time.
Mm.
And so I wonder, what is the decision making process of when it's like absolutely necessary to neuter him for his prostate issues, and when can it just be managed homeopathically?
Are you working with the homeopathic veterinarian at this
Yeah,
point?
I'm working with Dr. Jeff.
Okay, well, Dr. Jeff, you're the one that needs to speak up and answer her then. I would say, yes, absolutely. Homeopathy should be taking care of it. Now, my question for you, Sophie, is are you doing follow-ups with Dr. Jeff on a regular basis, or are you only going in occasionally? It's like for something like this, the slow recovery from anesthesia is sort of a symptom.
Yeah.
And so that should, when when he's completely healthy, the prostate will resolve, and he won't have the same problems
Anesthesia.
with the anesthesia. And in terms of his teeth, definitely be working. The tartar shouldn't build up once he's rebalanced homeopathically, but until then, you want to work with all of the different things that we suggest,
Yeah.
in
No, for
terms of
sure. Like
teeth.
he had I adopted him from a woman that had dementia, and she acquired him when she was 87.
Wow.
So he has had a lot of issues, and I've
Yeah,
only had him in
sure.
2 years. So we're working through a lot of
That's
things.
good.
But I
So just
do,
hang in there, and I'm
yeah.
going to turn it over to Dr. Jeff to be
Okay.
specific,
Thank
Oh,
since you're looking.
I just want to answer Sylvia's question, which I think is Sylvia we may have discussed before, but the answer to your question about when do you have to have him neutered when he can't pee anymore.
Okay.
When he's totally obstructed and trying to pee 2 days, nothing comes out. Yeah,
Oh
neutering.
wow. Okay, we're definitely not there at all.
Nowhere near that right now.
No. Like his other issues are more present than okay, but it was
Yeah.
just good to know in terms of because I just see him in discomfort, and I know that I'm not the most consistent patient of yours, and I'm working on that. That's why I joined VIP now. But I just wonder. Yeah, and we're gonna work through it. But yeah, it's just good to know that it's at that extreme,
Yes.
let's say, when
Good.
you take the decision. Thank you so much for that.
Great,
Thank you.
great
Have a good
question.
evening.
And as Miyokio said, definitely keep posting in the forum. That's something you can do ongoingly, especially as a VIP member for sure.
Sure. I'm just, yeah, because I'm one of those medical medium clients that has like chronic illness. So for me, it's very difficult to like log in and write and be online on screen and stuff like
Okay.
that. So that's why I'm
Yeah.
not the most
There you
consistent
go.
person.
Yeah.
But yeah, I'm
And
working on it.
what I was going to suggest, which I know we talked about last time, was just you've got your monthly calls already scheduled, or they're ready
Yeah,
for you, so just schedule them.
I have that scheduled for next week.
Yeah. That's all.
Okay, perfect. Thank you. See you.
And Dr. Jeff, did you see Sophie's post about logging in?
I did, and I
And
replied.
you replied. Okay, good. Very good. Thank you. Dawn, go ahead.
Oh, hi there. Can you hear me okay?
We can,
Oh,
yes.
okay. Yeah, I'm new to this channel and I'm so far really impressed and looking forward to joining more often. But I did
Good.
have one little question I put in the chat box, and if you want me to repeat that. I
Well,
have
yeah, go
a
ahead.
lab mix that's 4 years old, and we got her when she was a puppy. And
Right.
ever since she was a puppy, she's had acid reflux, and I've had to give her a Pepsid AC every night so that she won't throw like a yellow stringy bile in the morning. And she's very, very healthy. Otherwise, she does have some allergies, but I've tried halving the Pepsid, and she's on a very healthy diet. But I don't know what else to do. I've used Eastern and Western medicine, but by Eastern, I mean just herbal supplements. And I don't know what to do. It keeps her, um, she's okay with the pill, but without it, she'll start throwing up. And I just don't know what to do.
Well, for one thing is you say she's very healthy, and then you say she has allergies. So
Yeah.
so when there are quote allergies, whether they're skin symptoms or whether they are diarrhea, sometimes you can even say the reflux and things like that some people will call those allergies. That's an indication that they're not completely healthy. And
Okay.
the very best approach is to follow sort of the basic guidelines of plenty of exercise. How's the dog doing in general, other than in terms of activity and energy
She's
level?
has a lot of energy, and so I
Okay.
have to schedule extra walks and frisbee games, or I
Oh,
can
good.
tell she's just loaded with too much energy.
Okay.
So,
Well, there's never too much energy. So,
right.
um, and have you done anything with her microbiome? Have you done fecal transplant or probiotics, anything like that?
Probiotics for
Okay.
quite some time, but
Have you
nothing
tried
changes.
have you tried different probiotics?
Maybe 3 different kinds.
Okay. You may want to work with, and Dr. Jeff will pop it in the chat. Adored Beast has a wide variety of different probiotics and often walk you through sort of a series of it.
Okay, she did. She was on that for several
Oh,
months,
okay.
and I didn't see any change.
Okay.
So,
Well, when you've tried a number of things like this, it's always great when you have a dog that's got great energy and just has like this, little bit of a problem.
mhm.
Trying things on your own is wonderful. But it may be to the point now where it might be time to work with a Chinese medicine veterinarian, osteopathic veterinarian, or a homeopathic veterinarian so that we
Okay.
really completely rebalance that underlying energy field.
I did work with a doctor of Eastern medicine, and he's the one who prescribed all the herbs. He said she's a stubborn case, and he worked with her about a year, and he
Okay,
was out of
good.
options, but
Okay.
no homeopathy.
Okay, well, I've worked with some, there were times when I was in practice for 35 years as a homeopath where I would look like I'd run out of options, and then I'd refer them to a Chinese medicine veterinarian. And
Okay.
sometimes that would break it, it would move it forward. So I would say, since you've done that, homeopathy is your next approach. And luckily, it can be done virtually. And are you a member of Holistic Actions?
I'm not.
Okay. Um, so if you're a member of Holistic Actions, you can be a patient of Dr. Jeff's. If you go
Okay.
to, this is a free article, holisticactions.com/select,
Select. All right.
and read the whole article. It'll give you a good overview of working with a holistic veterinarian and why you may have to go to more websites than one, but you go to the homeopathy section to
Mhm.
AVH, and Dr. Jeff will pop that to just the avh.org,
It,
Okay.
Academy of Veterinary
yeah,
Homeopathy.
the direct referral
And that
pages.
directory you can do a filter for telephone consulting.
Okay. I'll do that then. Thank you very much.
Yeah, absolutely. And then also do the 101 course that we have,
Okay.
and that'll give you some other good framework. But you're doing a great job of don't you love how she's approaching looking at the whole? Not, she's doing the drug because that's what's working right now, and Pepcid's not that bad of a drug to
Right.
have to do, but she's realizing that if Pepcid gets rid of that symptom, but I have to keep giving it, I'm just palliating, I'm putting a band-aid on. So what I really want to do is to rebalance the underlying energy field. And and so we don't have the problem resolves. And then it's not going to create more problems later on. So good
Oh,
job.
oh, thank you. And I was going to do the emotional freedom technique, the
Mm-hmm.
tapping, but I haven't started that yet. But I'll go ahead and take the steps that you said.
Yeah, I would say it's been going on long enough, and because you had a TCM that sort of gave up on you, it sounds like it may be time to work with a homeopathic vet and at the same time do EFT.
Okay.
So
All
EFT
right.
is great with animals. It's one of the wonderful ways we can keep them happy and healthy. Because one of
Oh,
our
that's
keys,
good.
sounds like your dog is really happy.
Oh, she's a
So
happy
that's
girl. Yes.
good.
Well, I'll let you get to your other questions.
And,
Thank you, doctor.
Okay, great.
Okay.
Jeff?
yeah, before we move on, I would posit that your dog is very healthy.
Hmm.
Very, very healthy because his beam is high. He's maintained that symptom, reflux, for a while.
Good point.
And even Maya agrees. She jumped up and said, "You're right. You're exactly
Oh,
right. You're exactly right." Um, so yeah, you're doing everything great, but yeah, it's time now to address directly the internal energetic imbalance that is causing it all. And I realized when I had this discussion with my Tai Chi instructor on yesterday, and there was a bit of a disconnect when I started talking about the energy framework versus the physiological framework. What the disconnect is, I realize it's our cognitive dissonance, our brain's inability to believe that something so simple could be the answer. It is. It is.
okay.
It'll
Well,
come.
that's good.
It's all about energy. It's all about conserving energy. It's all about sustainability. It's all about things that are not right now part of medicine, but they are becoming, are being drawn
Yes.
into medicine. Yeah.
And you
You're on
guys
the
are the
right,
ambassadors. You guys are the ambassadors helping it happen by talking to when you have to work with a conventional vet. Hopefully, most of you don't have to, but when you do, you're the ones that can sort of shift them over. Jenny is a star at that. She's slowly gotten her vet moving slowly across.
more than one vet. Yeah,
That's right,
and
more than one
I would
vet.
say just the opposite. That doing what you're doing is going to make it easier to have more vet visits because there can be fun vet visits where they do an exam, they do diagnostics, they may or may not help you with what needs to be done, but they don't need vaccines, they don't need drugs, they don't need expensive anything. This is because you're doing, energetic hygiene, which is like the energy version of dental hygiene. We all brush our teeth every day. Well, we should all be doing a beam score every day and journaling and doing all the stuff that will maintain, equal balance. So I don't want to
Absolutely.
keep you from moving
Okay.
on. Yeah,
Okay,
sorry about that.
Dr. Silky.
Hello, my
Hi.
pleasure to be here. I'm not a veterinarian. I'm not a doctor. I'm only an architect. So
An
don't get
architect.
confused.
Well,
Yes,
do you have dogs or cats in your
yeah,
life?
both. But I have a very important question to you boys. You're doing
Hmm.
fantastic seminar today. I have a wonderful fox terrier. He's now getting 12 years old, or he is 12 years old. He has very healthy normally all his life. And actually, after the 3 months vaccines, he never got other vaccines because we tested his antibodies with a homeopathic vet every year, and he didn't get anything. However, I had to do because of the fear. And a normal vet told me a leptospirosis vaccine 2 years in a row. And last year he was very, very bad. He didn't walk at all. And he was like paralyzed. And we got him now 80% back, I think. But his energy dropped and he doesn't walk. Only very, very slowly. He's empathic. Let's say he doesn't want to walk. He's very slow, sleeping all the time. Only if he sees a female, then he's a little bit getting excited, but nothing more. For the rest, all his blood tests are perfect. The prostate is under treatment with the homeopathic vac, and he gets sulfur for stimulating his system, but it doesn't help very much. So I wanted to hear your opinion if after 1 year there can be still a side effect from the vaccine from leptospirosis.
Absolutely. So here's the thing, and I believe there are multiple ways to heal every animal and person and plant in the planet. But I love the framework of homeopathy, which says we have an energy field, and each energy field is unique, and each energy field has different susceptibilities. So some animals aren't susceptible to a vaccine, others are. And if they're susceptible to a toxin or the negative energy of people in the house or stuff happening out around, we never know what it is that an individual energy field is susceptible to. Whatever it's susceptible to, it pushes it off balance. Now, it's not that the lepto is still in the body. The vaccine isn't in the body causing the problem. Although I guess there could be some heavy metal stuff left, but mostly it's not. It's that the energy field got pushed off balance. To get back in balance, it's creating symptoms. So therefore, our goal is always to rebalance the energy field by whatever means we can. And then all of the symptoms will slowly go away. Even ones you think would not go away, like like bony proliferation in the body. You wouldn't think that would disappear, and it could completely disappear.
Oh, really?
So Absolutely. I mean, I had a dachshund I was treating that couldn't turn its head more than 30 degrees because it had bony proliferation under its spinal cord for 8 vertebrae at least. And after a few months of homeopathic treatment by x-ray, you could see it was completely gone.
Really?
Yeah, it took about 6 months, I think. So anything but as we were just talking, with there's no one right answer. And so sometimes homeopathy is the answer, sometimes Chinese medicine, sometimes EFT, emotional freedom technique, or Reiki, or scalar technique, or any of the multiplicity of energy techniques that are available. Intuitive healer, shamanistic healer, we never know what's needed to finally rebalance that energy field. But as long as you keep in your mind that we're looking at the whole, we have an energy field that's producing the symptoms. So we don't want to just stop the symptoms, but for your dog, we want this terrierness to come back. We don't want this
Exactly, yes.
lethargy to be there. We want a happy terrier to be there. So what is it going to take to get a happy terrier back? Okay, we don't worry about, well, it was because of the lepto, probably was, but more we're concerned now what to do. So the homeopath you're working with, who is that?
It's number one in Italy. It's called Dr. Dodicini.
And is that a veterinarian?
A veterinarian homeopathic. He does it
Okay.
all online. He looks at the videos and he gives stimulations, and he has also something for the prostate, which is under control. So for the blood test, he says he has a very good health, but he's only slowly, and he has a stiffness in his back, like you say, on the spine.
Right. So here's the thing. There are multiple different approaches to homeopathy. The classical approach, which is what Dr. Jeff and I do, is based on what Hahnemann decreed and experimented with and tested and used in practice back 200 some years ago. And then people have tried different approaches of using a remedy for a problem, or using a machine to make a remedy, or like that. Regardless of who you're working with, if you're not making enough progress, you need to move to something else. So I would say at this point, I don't care if he's rated the top in Italy
Exactly.
or not. I would shift to a homeopathic veterinarian who can work virtually, who is following the more classical approach of homeopathy at this point. Or it
Can I
might
not
be,
get in contact with you? Can I not get in contact with you, one of you?
so I'm no longer practicing as a vet. I do coaching. Dr. Jeff does. You need to be a member of Holistic Actions to be a client of his. And then you can. And then the other option, again, I haven't worked with her or gotten a lot of feedback, would be the woman I mentioned who's in Portugal that I posted in the chat. But definitely just become a member of Holistic Actions, and then you can schedule an appointment with Dr. Jeff separately from. So we have Holistic Actions, and then we have his practice, and homeopathic practice, and my practice of a coaching practice.
Okay. And the lady from Portugal, what does she do? Energy balancing?
She does a little bit of, she does intuitive work, and she may recommend homeopathic medicines. She may recommend herbs. She may recommend other things.
Okay.
But it's key. The most important piece here is you want to be paying attention to all of the symptoms sort of in total, but really focusing on that energy level. What we call BEAM in homeopathy: behavior, energy, appetite, and mood. If that starts getting better, then it's a clue that you're on to the right therapy.
But it didn't get better with the one I'm using now.
That's why that was the clue for me and for Dr. Jeff and Jenny and others. When we heard that, everybody's eyes sort of opened and we went, it's time for a different approach.
Exactly, and I'm fully onto this, and I'm waiting to find the right, because I'm very much believing also in Reiki or whatever. I didn't find somebody who could do it, because I tell you, the first approach of this new homeopathic doctor was Lycopodium. This is his personal stimulating immune system remedium. But after some potencies, LM potencies, it didn't function anymore. And actually he's slowing down. But when all the blood pressure, blood values are still good, he should be still a little bit active, you know?
Well, and again, it's all of the symptoms. So the blood is just one measure. The energy level is an important measure. The flexibility is another measure. So you're looking at all of them, but you want the energy level getting better. That's more important than a one-day measure of what is the blood work just shows what's happening that one moment when the blood was drawn. So it's over time you watch that. But in terms of energy healing, so we're each on, so let me back up just a little bit for everybody. Sort of I'm answering your question as well, Sophie. And we're each on a journey of health. That's why Dr. Jeff's book is called The Path to Wellness. It's a path. It's a journey that we're on. And nobody has the same path. Some of us, I mean, my first homeopathic remedy changed my life enough that I got married within a year. And that wasn't why I went to the homeopath. My vaginitis cleared up in 3 weeks that had been there for a year and a half. So that happened immediately. But then over the year, you know, other things I've worked on, I've had very slow results. And so I've had to experiment with different things. And now I'm back to homeopathy. So you often need different approaches for some people. Other times, one remedy and an animal's fine the rest of their life. One osteopathic treatment, and they're fine for the rest of their lives. Others, they need treatment over and over again, or they need 3 different kinds. They need some energy healing. They need, so it's, each of us needs patience for ourselves and our animals, and living in the moment, being present with our animals, having fun. You know, one thing for you to do with him is find out, yes, he's got sort of low energy level, but what makes him really, really happy? You know, explore. Maybe you can find something that will get him moving and get him happy. Yes. It might be partly you finding what connects with him, or sit down and meditate with him and ask him, what do you need?
Good point. Actually, I'm an animal communicator. Actually, I could do this. Yes, I'm an animal communicator. There we go.
So a lot of animal communicators forget to communicate with their own animals, or actually have difficulty communicating with their own animals.
Indeed.
So you may need to ask one of your friends, or when you become a member of Holistic Actions, we've had a number of animal communicators do webinars for us. And is one in Italy? Who's in Italy, Jeff? Isn't there one of our Greece?
Do you mean Monique in Switzerland near Italy, and or Eleni in Greece, or
yes, very good.
So you can reach out to others, but do it yourself too. You know.
Okay. I will try this because he likes to sniff out, so he loves this. And I have to admit, you're very good, doctor, because you find out that I'm not spending enough time with him. That the presence is not there enough. I can say this. And if I
Good.
get inscribed and get an appointment with Dr. Jeff, can he do also energy healing? Is it possible? Or whom you would recommend for energy healing?
All that we do is energy healing.
Well, the distinction between homeopathy
Okay.
and
No,
other
no,
energy
no. I'm
healing
not
is
even talking about homeopathy. We're talking about the
okay.
way the body heals is only by energy healing. And yeah, homeopathy is just really getting the body to do what it's designed to do anyway. And thank you, Christina, for getting where I was about to go. Since we have a bunch of other questions, but well, you said it
Thank you.
before. He is a terrier, and aside from getting him a girlfriend, find out what he loves to do the most, and
Okay.
or talk to Jenny, and then Jenny will let you know.
Fantastic.
But he's got it within him. The age thing is just and the
Yeah.
diagnoses
Yes.
are just
Okay,
you'll be able to
fantastic. I
move
don't want
past.
to take more time.
Sure,
Thank
doc.
you so much.
Sure.
You're
You're
welcome.
fantastic.
And then there
Fantastic.
was a
Thank
quick
you.
question. Sure. There was a quick question in the uh, about burping. So we need a little more to. She's not able to come up.
Yeah,
Yes.
Chris.
Can you hear me?
Oh, you can. Oh, I thought you said you
I just
couldn't
can't
speak.
raise my hand. I don't know why it
Oh,
won't let me
oh,
raise my hand.
okay.
But yeah, so my dog, he is 13 and a half years old, an American Pit Bull Terrier. I have him on a rotation diet. So it's commercially cooked, but it's not kibble. So it's like gently cooked. One day he gets chicken, another day he gets turkey, another day he gets beef. He's on that 3-day rotation, and they all have different veggies mixed in. And I've tried several different digestive enzymes, several different brands that I've mixed into his food. I've given him a slow feeder because I thought maybe he was just swallowing too much air because he was eating too fast. But he still is having a lot of burping right after he
When did
eats.
he, has he done this all of his 13 and a half years?
Well, I've had him for about 4 years. We rescued him.
Oh,
We
okay.
adopted him,
Thank you.
and so I don't know anything about his early life.
Okay. Has he
Other
been
than this,
burping for the 4 years he's been with you?
I think it's been more in the last couple of years. I would say in like the last 2 years, he has had various procedures where he had to be on antibiotics. He had a hemangiosarcoma removed. And he's had dental work where he had many teeth removed. So he was given antibiotics. I want to say that I feel like it was after that, after after
Of
he was
course.
given.
Of course, with hemangiosarcoma and dental, it's not just, and I wouldn't blame just the antibiotics.
Yeah.
That's like taking, you've got this whole ball of all sorts of stuff that was done to him and that was
Hmm.
happened, and you can't blame it just on the antibiotics. You have an underlying energy field imbalance. We don't know as earlier, what happened earlier, but this energy field is so out of balance it produced cancer, it produced bad teeth, it's producing burping. Burping is not too bad actually in the scope of things. If you look at what he's gone through, how is he overall? Does he have great energy, or over the last 2 years after the angiosarcoma and the dental, has his energy waned?
I mean, he's almost 14 years old.
Doesn't matter.
So, he's it's his energy is a lot lower than it was when we
Okay.
first got him. He has his little perks, where like if he sees a cat, well, not all cats, if he sees a certain two cats in the neighborhood, then he springs into action. He wants to run around. But he definitely doesn't do zoomies like he used to. He'll again little spurts. In little spurts, he'll run around. But mostly he likes to walk slow. He likes to lay around. Yeah, he's not super energetic
Okay.
the way he used to
So
be.
a number of the things that we've talked about today would apply. Okay. You could work, his energy field is clearly out of balance. He's sinking, less energy. So we need to rebalance the energy field. So homeopathy, great Chinese medicine, osteopathy, you're connecting with him. Like Dr. Silky said, she went, oh, I really haven't been listening to him. And I'm an animal communicator. So we still sometimes forget. So we have to see our animals as on the same plane as us, intellectually and emotionally, that they can communicate to us what they need and what they want. Maybe his zoomies is how he used to be, and now he wants to learn tricks, or he wants to do a snuffle mat, or he wants walks at a different time of the day. So it's a matter of working with where the animal is to see what they want. It may be exploring different diets. Rather than a cooked diet, you may try them on some raw. You may want to look from a Chinese medicine standpoint, a Chinese food therapy standpoint of what he needs to be on. Just explore. Sometimes a rotation diet can be good, at least it's a lot of different proteins, but maybe one of those is causing a problem. Track the burping. Is it better or worse when other things, is there any change in it over time? That kind of thing.
I have been keeping a log for the
Great.
last couple of years, and we did raw first. We were on
Okay.
raw first, and then we switched to the cooked because that wasn't going so well. And I have stuck with one protein for a while, and then did a secondary protein and haven't seen changes. He does do snuffle mats, and he definitely tells me when he wants to go walks.
Okay,
So,
good.
so he
Well,
gets
that's
he gets
good.
3 little walks a day. Like right now, I had to step away for a minute and then came back because he was like, "It's time to go walk." So
Good.
yeah,
So you're doing good. You're doing a lot of great things, Chris. That's really good. And the only thing I would say to add in would be to be working with a homeopathic veterinarian, just to, you know, get that energy field really well balanced. It's sort of the most reliable way to do it. Doesn't always work. So if it
gotcha.
doesn't,
Okay, I appreciate that. I
but
appreciate that.
that's
Thank
the
you.
next way to move. And are you a member of Holistic Actions?
Not yet.
Okay, well, definitely joining will give you a forum where you can post your concerns and interact back and forth. And when you do it on a regular basis, then you stay right up there. And when you're a VIP member, you get free calls, 15-minute question and answer calls once a month with Dr. Jeff or myself as well. So,
Okay.
all right, looking forward to
Sounds
seeing
good.
you.
Thank
Okay,
you.
you're welcome. Eden, go ahead. Love your name.
Mhm.
There we go.
There
Okay.
you go.
Thank you so much. Thank you. So my 7-year-old Bernedoodle is a patient of Dr. Jeff. And first, let me just say, I love that you keep mentioning osteopathy. I am an osteopath, so that's very cool. I have to do some craniosacral on my dog. I forget, but I do it. I do some, other forms of osteopathy on my kids, but I have to do that with him. So
Yeah, there you
that's
go.
cool. Yeah, I'll do that. I'll do that. So he had, yay, a diagnosis of ITP, and that was back in, say, January that he started his prednisone, and he was on a taper. He successfully got off of it 6 weeks ago. Yeah, it's June 19th. June 19th. So after that, a lot of good things were happening, and he had been on a protocol with Dr. Jeff, Nux Vomica, and that's what we do, and it's helped him, between coming off of the med and doing the protocol. It's been great. He also was given by our regular vet, regular but alternative, this I'm going to butcher the name, but Gui Pi Tong, the Chinese remedy. So there's like a bunch of stuff in there. But I don't know. It's an teaching that there's toxic heavy metals and Chinese herbs. So I didn't know. I didn't know how long to, stay on this stuff. He's on quite a bit of it for months now. Um, the vet, who's great, she kind of like isn't 100% sure what kind of taper. I just thought I'd get, I don't know.
Sure.
I'm not going to hold you all to.
Well, you don't need to worry about necessarily tapering in terms of Chinese herbs, but the more important piece is, are you doing regular follow-ups with Jeff? So is Jeff
Now,
being
yes. Now,
okay?
yes. Better. Yeah, we're good.
Okay, because
I side
that's
texted. He was okay with this. He was okay with me asking. So yeah.
sure.
Yeah.
The key thing for everybody is whoever you're working with, whatever modality you've picked and whatever professional you're working with, you need to make sure you have scheduled appointments after each visit. Some of them don't do that. Some people,
Yes.
some professionals for people or animals are not very good. Dr. Jeff. And so it's up to you. You're your animal's advocate. So that's number one. Number two, because we have to keep the momentum going of healing.
Absolutely.
And then number two is Chinese medicine tends to do a lot of herbs and keep them on all the herbs. And sometimes that's wonderful. Seizures go away and stay away as long as they're on the herbs and nothing else happens. So anytime you're on any kind of a supplement, even if it's like chondroitin sulfate because you have a stiff dog, if you have to stay on it in order to ameliorate the stiffness, then the energy field hasn't been brought back into balance yet.
Right.
And so with the Chinese herb, in terms of stopping it or not, you're going to have to figure out what it's doing, how much benefit there's been to it.
Yeah.
And that would be the conversation to have with her, is what would you expect what did it help, and what would you expect if I start to taper off of it? And will help you. But also, if you're working with the homeopathic medicines regularly with Dr. Jeff,
Every day.
then as
Yeah,
you're tapering, no, I mean the consults with Dr. Jeff.
Yeah.
We hopefully don't have to stay on the homeopathic medicines forever either, but sometimes we do. So as you're tapering the drug, if something shows up as a symptom, then that's another clue as to what homeopathic medicine is needed. Because it's all the same thing. It's an energy field
Yep.
is responding to the Chinese medicine, causing something to happen. So if, as you pull away from that, symptoms appear,
Yes.
maybe they were just blocked by the medicine instead of
Right.
instead
true
of really
healing.
heal instead
Yes,
of true healing.
yes.
You know, and you certainly see that with osteopathy. So
Yes.
makes sense.
That makes a lot of
Sounds
sense.
sounds like you're on the right path, and
Thank
keep
you.
post things like that in the forum. That'd be a great thing to post in the forum,
Okay.
so we could, so other people, if they do a search for Chinese herbs,
Yes.
and make sure you say, as an osteopath, I blah blah blah, say something, and then
Yeah.
if they search for osteopath, they'll
Right.
come up. And so we're out of time, but I
Okay.
have two things I want to ask you or suggest. One is make sure anytime you're around other osteopaths, and make sure you're doing this yourself. When you're treating people, you ask whether they have pets in their life. That's just part of your intake, or you know it as you're doing the intake. So make sure you tell them, by the way, everything we do for yourself holistically, including osteopathy, can be done on animals. So make sure you're treating your animals with the same holistic perspective that you are treating yourself. Because I have people come to, like you went, oh, I've been doing other stuff. At least you've been doing other, or,
Right.
They
But
forget.
here it's like
But we
right
have
there.
to spread the word. People have to know that we can do all of this holistic stuff with our animals. So
Absolutely.
that is important.
Thank you. Thank you.
You're welcome. Jeff, any final words? He's meditating.
I have lots of final words, and I can't believe we're out of time. So I'll save them, a lot of them for Monday, which will be our mobility month webinar. We want to talk a little about oxytocin and muscles and stiffness and the power of love. So I guess my last word is just love up your pets and help them do what they want to do and what they love the most, because that will help them more than anything else.
And when they're not doing well, and when you're not sure what needs to be done, just keep loving them and love yourself. Don't feel guilty about anything that's happening or has happened. It's just what is. And you just be in the moment with it as best you can. We've got some interesting in the forum chats going on about some of that. So just love, pure love, each other.
So thank you all for coming. Thank you for your time, energy. We'll see some of you guys on Monday at the webinar at 8. And everyone else will see at the end of August or before. Thank you. Thank you. We love you. Love up your pets. Bye. Thank you for the great questions. Bye, Christina.